Jessica Myers, and I'm going to do a head-to-toe assessment. Now I'm going to scan the room to prove I'm not using any note cards. Alright, first I would check the patient's chart or the doctor's notes to confirm that I'm supposed to be doing this assessment. I would then provide privacy in the setting as a closed door. In other scenarios, it could be a closed curtain. I would then wash my hands or use hand sanitizer, depending on what is available. Then the interview would begin. Hi, I'm Jessica. I'm going to be your student nurse. Can I have your name and date of birth?
Kendra over 11095.
Alright, and as she's saying that, I'm confirming with her name band. Okay, can you tell me where you're at today?
Doctor's office.
Okay, can you tell me the date?
November 26th.
And who's the President of the United States?
Trump.
Okay. So with that, my patient is alert and oriented times 3. Looking at my patient, the facial expression is appropriate for the situation. No respiratory distress or use of accessory muscles. The posture is relaxed and appropriate. The patient is appropriately dressed for the season. Speech so far has been straightforward, no issues, no slurring, and the thought process has been logical as of now. Alright, so I'm going to ask you a couple questions and then go from there, okay?
Mm-hmm.
So I'm going to start with your head. Do you experience any headaches?
No.
Do you have a family history of headaches or migraines?
No.
Any surgeries dealing with your head?
No.
Any hair loss?
No.
Okay. Alright, so I'm going to inspect the scalp. And as of now, the hair is equally distributed. The hair looks fine, shiny, non-gritty, and not dirty. The patient's well groomed. Next, I'm going to palpate the scalp, if that's alright.
Mm-hmm.
So we'll just... In other settings, I would more than likely wear gloves, but for this one, I'm not going to. Alright, no lumps or masses noted. I didn't feel any abrasions on the scalp. The scalp didn't feel dry. There was no flakiness, so that's good. Alright. Next, I am going to do the cranial nerves. So first I'm going to do cranial nerve 1, which is smell. Do you have any issues with smell?
No.
Okay. Alright. And if I wanted to go further, I could have her smell an alcohol pad or something to test that. But for the purpose of this, I'm not going to. Okay. So cranial nerve 1 is intact. While I'm doing the nose, I'm going to look inside. So I'm going to splash the light up in there. Okay. Hair is evenly distributed. The mucosa is moist and pink. There's no perforations or deviations in her septum. Her nose is midline according to her face. And then nares are equal bilaterally. So that is cranial nerve number 1. Cranial nerve number 2 has to do with eyesight. Have you recently been to an eye doctor?
Yes.
Okay. How recent?
A couple weeks ago.
Okay. So since she recently went to the eye doctor, we're not going to perform the visual acuity test using the Snellen chart. But if we were going to, she would stand at a 20 feet mark and read down each line that would see how far that she can go. There is only allowed 2 mistakes. If the third one, there's 3 mistakes, then you'd have to go by that first one with the only 2. So cranial nerve number 2 is intact for this. As I'm looking at her, I'm noting that her eyebrows and eyelashes are equally distributed. The sclera is white in both eyes. The pupils are round. The irises are nicely colored. No irregularities. No opacities in the corneas. I'll just look at your conjunctiva real quick. I'm going to pull down. It might be a little uncomfortable. Alright, conjunctiva is moist and pink. So there's no issues there. I'm going to shine this light in your eye twice in each eye, okay? Might be a little uncomfortable. Just let me know. So As I'm doing this, I'm checking for consensual and direct construction with which both eyes did, equal bilaterally. The pupil size is about a 5 millimeters due to the lighting in this setting. So okay, check the eyes, nose. Next, we are going to do cranial nerves 3, 4, and 6, which has to do with cardinal gazes. So I'm going to move my pen light, and I need you to follow it with only your eyes, not moving your head, your neck, or anything. Is that okay?
Okay.
All right. So just follow. Okay. So there's no lagging with or irregular eye movements. There was a smooth movement to each spot. So cranial nerves 3, 4, and 6 are intact. I am now going to move to cranial nerve number 5. So I'm going to palpate your TMJ. I just need you to open your mouth for me. Move it around side to side if you can. Okay. So no cracks or popping noted. Next I'm going to do a facial sensation test. So I'm going to use a Q-tip for this, and you're going to tell me where you felt the touch and if it was soft or sharp. Okay?
Okay.
All right, can you close your eyes for me?
Left forehead soft. Right cheek hard. Left cheek lowered by my jaw hard. Right forehead hard. Left cheek hard.
All right. So there's no issues with the facial sensations. So cranial nerve 5 is intact. We already did 6. We're going to move to 7. So can you puff your cheeks for me? All right. Can you smile? Can you frown? Can you raise your eyebrows? Can you lower your eyebrows? All right. So that shows that cranial nerve 7 is intact. There was no issues with the movements. Next, we're going to move to cranial nerve 8, and that has to do with your hearing. And while I'm doing that, I'm going to just look at your ears. Both ears are normal size. They are symmetrical. She does have piercings in both lobes of the ears. I'm just going to inspect them real quick. Light, normal cerumen, pink color. No redness or swelling in that one. I'm going to go ahead and go here. Alright, no excess cerumen, pink in color, no redness, swelling, once again. Alright, I'm going to do a couple things real quick. Alright, just tell me if there's any tenderness.
No. No. No.
Switch to the side.
No. No. No.
Oh, okay. Well, that's good. There's no tenderness noted. Alright, I'm just going to have you stand up for me. And as I'm looking at her, I'm also noting that her head is normal cephalic, and there's no odd shape to her head. It's a nice symmetrical shape. Alright, so first I'm going to have you do the Romberg test. So I'm going to have you stand kind of away from the table. Alright, just like that with your eyes closed. Okay, alright, there's no swaying noted, so your equilibrium is good. Next, I'm going to perform the whisper test. I'm going to whisper 2 different words, and you need to tell me what side you hear it on and what word I say, okay?
Okay. Left side ball. Right side kite.
Alright, tell me what side you hear the noise on.
Right. Left.
Okay. That is that. The Romberg and whisper test. I'm going to have you stand up still. I'm going to perform a couple other tests real quick. Alright. So I'm going to have you reach your arms out. And then touch your nose. Touch your nose. Arms in circles, doing some range of motion, circumduction. Alright. Now, I'm going to have you put your arms straight out. Alright, pronation. Put them up for supination. Bring them in. Flexation. Extension. Pronation. Alright. That is good. Real quick, I'm going to have you walk to the wall and then back towards me. I'm assessing her gait, and while watching her, she has normal gait, no abnormalities, no limping. Alright, one more quick test real quick. I'm going to have you take your heel, run it down your shin. Alright, same with the other one. Okay, no issues with that. I'm going to have you sit back down. Sorry. Alright, so we did ears, nose, eyes. Okay, so we did 7. We're going to move to 9 and 10. So if you could open your mouth for me and say ah.
Ah.
Alright. So no dental work noted. All teeth are intact. The buccal mucosa is moist and pink. The gums, hard and soft palate, along with the tongue and pharyngeal wall are pink in color, as well as moist. I probably already said that. Tonsils are noted as +2. Can you stick your tongue out for me? Alright, can you move it up, down, side to side? Alright, normal tongue movements. Tongue and uvula is midline. The soft palate and uvula raised midline as well, so no issues there. Alright, the lips are also moist and pink. And as I'm looking at the face, the color is normal for ethnicity. The hair is evenly distributed. Just gotta feel your face real quick. Temperature is warm, skin is dry. So that is good. Okay, so I went through all of that. I just gotta do 11 and 12. Alright, so I'm gonna shrug your shoulders for me. Up, alright. That's testing strength. Can you push against my hand? Push against my hand. Alright. Cranial nerve 11 is intact. And for 12, I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Alright, since she was able to say those words, cranial nerve 12 is intact because you have to use the tip of the tongue. So I did cranial nerve 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12. Alright. So that is good so far. I'm going to palpate your temporal artery. Alright, that is a +2. I'm going to palpate your sinuses. Let me know if there's any tenderness.
Okay.
Alright, any tenderness there?
No.
How about there?
No.
Alright. Now I'm going to move to your lymph nodes. I'm going to do your preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical. Alright, can you have me tilt your head? Deep cervical. Again, deep cervical. And can you shrug your shoulders for me one more time? Supraclavicular. Alright, and then I'm going to go behind you. I'm not trying to choke you. I just got to displace your trachea. Feel for your thyroid. Alright. Your lymph nodes and your thyroid gland were non-palpable, which is good. If they were, that could be a sign of infection. As I'm looking at her throat is not swollen. No lymph nodes are able to be seen by the naked eye, and there is no tracheal displacement. Alright, so real quick before I forget, check Sternberger. No tenting noted. So hydration is well. Alright, so next I'm going to palpate your carotid. I'm going to do one at a time, because if you do two, you can make the patient pass out. Okay, +2. +2, equal bilaterally. Okay, so next I'm going to assess for bruise. So what I'm going to have you do is breathe in, I'm going to breathe out, and hold your exhale. I'm going to do the same thing so I know when you need to breathe. If you need to breathe before that, just breathe. We can start over if we have to, okay?
Mm-hmm.
For this, you use the bell of your stethoscope. I'm going to switch that over. All right. Breathe in and out. Hold that exhale. All right. And breathe. All right, we're going to do it again. So breathe in, breathe out, hold that exhale. All right. No bruise noted, no thrills. That is very good, because we do not want that. Okay, so I've done the head, neck. Now I'm going to move to your interior chest. Okay, inspecting the skin. It is normal for ethnicity, even hair distribution, no abrasions, lesions, no contusions, no lumps, masses noted from being able to just look. Alright, next I'm going to palpate. Let me know if there's any tenderness, okay?
Okay.
Alright. Sorry. Any tenderness?
No.
Okay. Next I'm going to percuss the areas. I'm going to start at the apices of the lungs and then go down to about T6. You want to go in between the ribs and the intercostal spaces so you're not hitting bone. Alright, can you lift your shirt for me? Alright. It was a nice resonant sound, and that's what we look for, no dullness. If there was dullness, there could be fluid in the lungs, but luckily you don't have that.
Okay.
So now I'm going to listen to your lung sounds. I'm going to need you to pull your shirt back up for me.
Mm-hmm.
Alright. Now I'm going to have you breathe in and out, a nice deep breath, and each time I move my stethoscope is when you're going to breathe, okay?
Okay.
Alright. Reach down here a little bit, sorry.
Mm-hmm.
Alright. Lung sounds were clear bilaterally. There was no adventitious sounds, no reels, no wheezing, no rhonchi noted, so that's good. That sounds really nice, actually. Next, I'm going to listen to your heart sounds, and I'm going to use the ape to man method. Alright. So first we start off by finding the sternal notch. going down to the angle of Louis and finding that second intercostal space. We then go to the right for your first aortic. So this would be the second intercostal space, right sternal border. Then we go down to the second intercostal space, left sternal border for the pulmonic. Alright, and then you go down one for Erb's point. Alright, then you go down to the fifth intercostal space, which is usually under here a little bit. And then you go fifth intercostal space, mid-clavicular line. This was the tricuspid and now the mitral. This is also the PMI, which is point of maximum impulse. Alright. So sounds 1 and 2 are present. No murmurs or any abnormalities noted. While looking at that PMI, there was no heaves or lifts, which is good. I'm going to ask you a couple questions now regarding your lungs and heart. So, do you have any history of upper respiratory infections?
No.
Do you have asthma?
No.
Any family history of asthma?
No.
Okay. Do you have any chest pains?
Nope.
Do you have any irregular heartbeats?
No.
Okay. Do you have any family history of heart disease?
No.
Any family history of COPD?
No.
Okay. All right. So that's good. That is for the front. We are now going to move to the back. All right. So the back is a little different. I gotta pull this up again. Sorry. Inspecting. There is a small lesion on her right side. Skin is of normal color for ethnicity, even hair distribution. Skin is dry and warm, and no other abnormalities noted. So for the lung fields on the back, you want to go ahead, you put your head forward, find the C7, just the vertebral prominence. And then you want to find the bottom of the scapula, which is T7. And then you'd walk down 3 intercostal spaces to T10. And that is your lung field. You also want to go in kind of a looped pattern so you're not hitting those scapulas. Alright. So first I'm going to palpate. Let me know if there's any tenderness, okay? Alright, any tenderness?
No.
Okay. Next, I'm going to percuss. I'm starting at the top. Making sure not to hit any bones. I want to go in between the scapula and the spine. You want to go to T8 up to T6 on the lateral side. So we're just going to lift this up a little bit. Alright. Lung sounds were resonant. No dullness noted on the back as well. Okay. Now I'm going to auscultate. I just need you to take a breath in and out, the same as the front. Each time I place my stethoscope, okay?
Mm-hmm.
And depending on the person is how many places you would put the stethoscope. Different people have different size lung spaces, so there might be some people where you do more sites of auscultation than others. Alright. Once again, no adventitious sounds, no rales, bronchi, or wheezing. We gotta hold that up one more time, I'm sorry. Alright. So first I'm gonna do tactile primitus. So each time I place my hands, I'm gonna have you say 99, okay?
Okay.
Alright.
99, 99, 99, 99, 99.
Okay. So as my hands went lower, the vibrations decreased, which is what we look for. Next, I'm going to do your symmetrical expansion. So can you breathe out for me? Alright. I'm gonna pinch skin at the T10. Alright, breathe in. And out. Okay. Expansion was symmetrical. Next, I'm going to check the AP diameter. So what you do is you take half of the back and then compare it to the side, which is a 1-to-2 ratio, which is what we look for. If it was anything other than that, it could mean a barrel chest, which is usually very common in those with COPD. So, okay, there's that. Some bags. Alright, can you lay down for me?
Mm-hmm.
Alright. So while I have you laying down, I'm going to check your jugular distension, or forejugular distension. There is none noted. If there was, I would raise the patient to 45 degrees to see if it went away, and then go from there. Right now I'm going to check the extremities. The arms are warm, dry. There is no edema present on the bony prominence of the arms. Alright, I'm going to go ahead and check for your brachial arteries, okay?
Okay.
Alright, I'm going to note those as +2, equal bilaterally. I'm going to go down to the radial. Alright, +2, equal bilaterally as well. Okay. I'm gonna do a couple strength tests for me.
Mm-hmm.
So can you pull my fingers? Alright, and can you push against my hands? Alright, and then I'm gonna have you pull. Okay, no issues with strength. I'm gonna just do a quick capillary refill. Alright, it is less than 3, which is what we look for, so that's good. Okay. So next I'm going to inspect your abdomen.
Mm-hmm.
Alright. So while I'm doing this, I'm going to ask you a couple more questions, okay?
Mm-hmm.
So, first off, have you had any loss of appetite?
No.
Any nausea?
No.
Vomiting?
No.
Okay. Do you have any problems urinating?
No.
Any burning while urinating?
No.
Any blood or mucus in your urine?
No.
Okay. When was your last bowel movement?
Earlier today.
Alright. Any irregularities with your bowel movements?
No.
Any blood or mucus in your bowel?
No.
In your stool? Okay. Are you sexually active?
No.
Okay. So, have you had any full-term pregnancies?
No.
Okay. Do you do any self-care, such as breast exams?
No.
No? Okay. So, I'm going to inform you of that right now while we're doing this. When you perform a breast exam, you want to do it about the same time every month. It's easier to do it in the shower. So what you would do is you would raise your arm above your head and you would take these 3 pads of your fingers and inspect your axillary in circular motions, and then you would go around your breast as well, and each time getting closer to the nipple. And you would want to do it the same way each time, and if there's any irregularities like very hard lumps or tenderness, you want to notify your doctor. Okay?
Okay.
I'll give you a pamphlet at the end of this, alright?
Okay.
Alright. Also, one more question, I'm sorry. Have you had any abdominal surgeries?
No.
Okay. So looking at her abdomen, the contour is flat. The color is appropriate for ethnicity. There is a little bit of striae. There is a navel piercing. The umbilicus is midline. No distended veins or abnormal pulsations in the abdomen. The skin is warm and dry. So, alright. That is my inspection of the abdomen. So first what we want to do is auscultate the abdomen. You want to auscultate first, so because if you percuss or palpate, you're moving stuff around and you won't get an accurate reading. Alright. So for this, you start in the right lower quadrant. You want to do at least 2 spots per quadrant. It could be more depending on your patient or less. Alright, bowel sounds are present. They are neither hyper or hypoactive. Next, I'm going to auscultate using the bell for the aorta, renal, and iliac arteries. So to find the renal and aorta arteries, you the navel. So renal, aortic, and renal again. Alright, no bruits or thrills noted. Alright, I'm just going to pull this down a little bit. And then for the iliac, you do a V. Alright, once again, no bruits or thrills noted, which is what we look for. It's caught in my hair. Alright, next I'm going to percuss your abdomen. So once again, starting in that right lower quadrant. Alright. So there was a very tympanic sound, which is what we look for, except for over the liver, which tends to be dull because the tissue is dense. Next, I'm going to do a light palpation, which is about 1 centimeter deep. In a normal head to toe, you would do a deep palpation following that, but for this, we are not going to do that. So once again, starting in that right lower quadrant, but first we want to ask your patient if they are in any pain. Are you in any pain anywhere in your abdomen? Any discomfort?
No.
Okay. If you are, at any time, just let me know and I'll stop and we'll go from there, okay?
Okay.
Alright, so. Alright. No masses, lumps, or anything noted. So your abdomen looks pretty good. Just pull your shirt down. Alright, I'm going to move down to your legs. The legs are nice and warm, dry in temperature. Normally we would assess the femoral artery, but since that is invasive, we are not doing that for the purpose of this video. So right now I'm going to palpate for your popliteal artery. Alright, that's about a +1 on that one. I'm going to go to this one. About a +1 is that on that one as well. Those are a little bit harder to find. It depends on the patient. Alright, I'm going to go down to the posterior tibial artery. Alright, that's a +2, equal bilaterally. And the dorsalis pedis. Alright, once again +2. I'm going to go ahead and check your capillary refill on your toes. Alright, less than 3 seconds on all those. There's also no edema noted on the bony prominences of the feet. Alright, I'm just going to have you stay there real quick. I'm going to do a couple tests, alright? Alright, first we're going to do that sensation feeling again. So I need you to tell me if it's soft or sharp, okay?
Okay.
Alright.
Right sharp. Right sharp. Left sharp. Left sharp. Right soft. Left soft.
Okay. So the patient does have sensation in her feet. There's no issues noted. I'm going to check for the Babinski reflex. Alright. Alright. Normal plantar flexation noted. And that's what we look for. Alright. So I'm going to have you lift this leg for me. Okay, put it down. Lift this leg for me. Alright, put that one down. Can you turn your feet inwards, inversion? How about outwards, exversion? Alright, range of motion is good. Do you have any issues with your muscles or joints?
No.
No? Okay. Just a couple more things. I'm going to have you push against my feet, or my hands. Alright, and then pull against my hands. Alright, strength is good in the feet and legs. So, alright, pretty sure we went over everything. I'm going to help you out. Okay. Do you have any questions or concerns that you want me to ask the doctor?
No.
Alright, well, I'm going to go document my findings. I didn't find anything abnormal, so that's good. I'm going to let them know and then we'll proceed.
Okay.
Thank you.